Health Connect is a health information exchange organization in the state of Michigan. We have 85% of the acute care beds, or 129 hospitals, participating in the network today, with over 4,000 other connected physician offices or other stakeholders in the healthcare ecosystem. Transact a little over 1 billion messages a year right now across a wide range of different solutions that we're offering. One of the solutions specifically is our virtual integrated patient record, VIPER, which is our longitudinal care record for the community. And we had one situation where a gentleman walked into one of the emergency departments in town and complaining of different things. The physician worked them up, put them in a room, and was waiting for the testing to be completed when he realized, I'm doing this pilot with Great Lakes, maybe I should check the VIPER record. And when he did, he found out that individual had been to another emergency department across town and discharged 30 minutes before having arrived at this particular emergency department. So he's able to see the results of all the testing that he had ordered, to see that there was nothing wrong, and able to cancel the testing that had been ordered in his facility, and also bring in the right kind of resources from a behavioral and social service setting to understand why this person was jumping across emergency departments. So I think the value there is twofold. One, they provided much better appropriate care to the individual that was in their emergency department, which is most important. But it also potentially saved hard dollars for them, to the extent that those would not have been reimbursed and may have fallen to their uncompensated care line as well. So it was a win-win in a couple of different ways. I think the future looks good. I think that there will certainly be standards developed that makes the just native communication between the EMR vendors easier. So hospitals that need to connect with the ambulatory providers that are out in their community, that will be made easier to some extent. I think, though, that it will never be that the standards that are developed will just solve all of the exchange problems that the workflow is going to require. As individuals either move through our behavioral health settings, move through our social service settings, and the important part those are increasingly playing, and depending on the specialty that they want to see, all of those workflows are very different. So I think there's always going to be a need for health information organizations like ours to, at a very practical level within the community, say, how do we need to connect all these various physical, behavioral, social, even health plan payer parts of the healthcare ecosystem in a way that reduces the cost and improves the care for the folks that need it. And so technology, the way we do that is always going to change. The standards will change. Technology is always going to improve. But as long as we keep our eye on kind of that core ball of very tactical things in the community to help people, we'll be in good shape. Yeah, well, certainly the intent with Meaningful Use in getting providers more automated and getting rid of the paper charts made some progress there. Meaningful Use itself will be ending, but MACRA absorbed some of the focus there to keep physician offices and other clinicians kind of moving along the technology front. I think the way they've done it is better, in that unlike Meaningful Use, it's not mandating the how as much. It's providing a direction. It's providing some outcome goals that it wants to achieve. But Meaningful Use was much more prescriptive in how you had to go about things. And I think within MACRA, they've headed in a much better direction of kind of laying out the direction and then letting folks get a little bit more creative about how they go about hitting those goals.